On February 28th, it was a normal day. We came to work and Mom and I had lunch together, and I left to go pick up my niece from school, and we walked back in the cleaners and Rihanna said, "Hi, Grandma," and Mom did not answer her. And I looked at her and I said, "Mom, Rihanna's talking to you." And she said, "I don't see Rihanna." And I looked at her again and I noticed that her face was drooping. And I said, "Call 911 because she's having a stroke." My mom is the president of the corporation, and she's also the dry cleaner, and she works her tail off every single day. She is independent. My dad passed away when he was in his 50s, so she's lived by herself since that time and done everything for herself.
I have a lot of family history with strokes. I had 2 aunts that passed away with strokes, and then in last October, my sister passed away with a stroke.
An ischemic stroke happens when something, usually a blood clot, plugs up one of the arteries in the brain.
These types of strokes, especially in the elderly population, are either not survivable immediately thereafter the initial event, or the patients go on to have severe disability for the remainder of their lives.
You may pretty much lose everything that was important to you unless we can get it treated and reverse the effects of that stroke.
I've heard for so many years the signs to look for a stroke. It's like, we've got to call now. Can't waste any time. The fire department, I believe, came, and the ambulance came. They said, "Kay, we do believe you're having a stroke." And she said, "No, I don't think so."
I remember that there were a lot of firemen standing around me, and somebody said, I think the nurse said, "Well, you have high blood pressure." And I said, "Well, if you had all these hot firemen standing around you, wouldn't you have high blood pressure too?"
All of the systems were working perfectly. She got here quickly, we recognized it quickly, we treated it quickly. And as soon as that clot buster medication was started, we then took her over to the interventional radiology suite and proceeded to do a procedure where Dr. Balkley was able to go into her brain and remove the blood clot from that right middle cerebral artery. In her case, the blood clot was plugging up such a big artery and the clot was so large that it would take some time for it to dissolve. And rather than wait for it to dissolve or hope that it dissolves, which sometimes they don't, in her case, we were fortunate to have somebody of Dr. Balkley's expertise and diligence able to go into her brain and take that clot out before the permanent damage occurred. Once the procedures were done and we got everything settled upstairs and I was able to examine her, I couldn't tell that she'd had a stroke. I kind of encouraged her to take a few days off. Kay did not follow my advice.
My mom is probably one of the most amazing women because she is 77 years old and works probably a 60-hour week. And she's been through a lot with her family. She's lost both of her sisters and her brother and aunts to strokes. And it was tough. But she's strong and we're here. I don't see where anything has changed since the stroke. She's doing exactly what she was doing before it happened.
A little slower though than when I was 20.
K is not a statistic. K is the typical patient that we see in stroke interventional care. It is absolutely extraordinary to see these patients regain function because they're basically back to normal that day or that evening. It's just truly remarkable what technology has allowed us to do in the right capable hands. I mean, the fact that we can offer this in Casper, Wyoming it just still blows my mind.
And I think it is so awesome that Dr. Wheeler has tried so hard to bring medical assistance to rural areas.
We now have the ability to save lives. Next step is to make this life-saving treatment available to more people around the state. Half of our people live more than an hour away from their nearest hospital. And yet, I believe, and I intend to work to make sure that every single one of them has the right to access the best available care. And as long as we remain available and vigilant and ready to do the work, which I'm proud to say that we are, because this team is amazing, then we can save more and more lives.
I think that without the doctor and the staff at Wyoming Medical Center and the equipment they have, I would not be here today.
To Dr. Balkley, Dr. Wheeler, to all of them, all I can say is thank you so much for being the people they are and for caring about their patients. I think we're very fortunate to have Wyoming Medical Center in our community.
There is no gift you can give another human being that parallels the significance of health. And giving Kay back her life is, it gives me the shivers just to think about it, because she can be Kay.
Well, I was going to retire when I was 75, and then I decided maybe I'd retire at 80. 75 is too young.